Hi, this is Leticia Guerrero. I'm also calling in on behalf of the IHSS workers that are there today. I had an emergency and I wasn't able to make it. But I just wanted to share with you all the information that IHSS is significantly more cost-effective than institutional care. It prevents costly placements. IHSS allows low-income seniors and people with disabilities to remain in their homes without reliable work. This workforce, these individuals often end up in skilled nursing facilities where monthly costs can be even 6 times higher than in-home health care. IHSS reduces emergency services. Stability in home care reduces the frequency of preventable emergency room visits and hospitalizations, which often fall on county-funded health systems, straining the county budget even more. Solano County faces a recruitment and retention crisis that threatens the delivery of essential services. Research is showing that the wage increases can reduce workforce turnover by up to 30%. Lower turnover reduces the administrative burden and costs associated with constantly processing new provider applications. Competitive rates in neighboring counties like in Napa and Sonoma are over $20 an hour. They've already implemented higher wages to attract caregivers. Without a raise, Solano County providers will continue to commute for better pay, leaving Solano residents without care. Wage increases for low-income workers have a high multiplier effect because these funds are typically spent immediately within the local community. They are vital to the boost in the economy. A study in nearby Alameda County that estimated that raising IHSS wages to $20 an hour would generate an additional $182 million in economic output and support nearly 1,000 additional jobs. Higher wages lead to increased local tax revenue from sales and property tax in large counties. Such increases can generate millions, in addition to state and local tax revenue. Let's not forget the most important, improving quality of care. Higher compensation is directly linked to better health outcomes for the county's most vulnerable residents, your constituents. Higher pay increases the likelihood that consumers can find and keep a provider that they trust, which improves the quality of match and leads more stable long-term relationships. Competitive wages allow the county to demand higher standards and encourage providers to invest in their development with things such as CPR certification, first aid training, and many more, potentially a career in nursing. As of early 2026, Solano County's IHSS wage is $18.10 per hour. This rate is significantly lower than that of several neighboring Bay Area counties, which have already reached or surpassed $20 an hour. These providers are not even asking that much. So we're hoping that y'all can come back to the table with a reasonable wage that we know it would not be a livable wage, because even $20 an hour is not a sustainable, livable wage in these Bay Area counties. So we hope that you will come to the table with a wage that will get our providers a contract. Thank you.
Thank you.